So the Coronaviridae family is broken up into alpha coronaviruses, beta coronaviruses, and gamma coronaviruses. Alpha coronaviruses have TGE of swine, PED, feline enteric coronavirus, and FIP, and dog coronaviruses. The beta coronaviruses have bovine coronaviruses and hemagglutinating encephalomyelitis. And the gamma coronaviruses have infectious bronchitis of chicken and coronaenteritis of turkey. So TGE stands for transmissible gastroenteritis virus. This is an alpha coronavirus and it's found worldwide. However, cases nowadays are mostly in the United States. The virus can be found and shed by pigs and dogs and mice as well. It is shed in the feces and the discharges. The virus enters the body through the oral nasal route, and then the replication happens in the epithelial cells of the lungs or the intestine. This causes atrophy of the villi, and then decreased lactose digestion will occur, and this will increase the osmotic pressure. And then the sodium-potassium transport will be broken down, and this causes hyperosmotic diarrhea. In young animals, the clinical signs are vomiting and yellowy diarrhea. And older animals have mild clinical signs, however they mostly just get weight loss, and they can also get watery diarrhea. The most susceptible animals are piglets under 10 days old who do not get enough colostrum after birth. They have 100% mortality. And in the pathology, we see inflammation in the small intestines, not the large intestines, as well as a dilated stomach full of undigested milk. To diagnose, we can use PCR, ELISA, and immunofluorescence. For treatment, for piglets under 2 weeks old, it is very hard to treat them, but you should give them electrolytes and fluids. For prevention, there is an attenuated oral vaccine for piglets. Porcine epidemic diarrhea is also part of the alpha coronaviruses. Type 1 was found in England in the 1970s and it was mostly in fatteners. And type 2 originated from the United States. It affects pigs of all ages, including piglets. The virus is mostly found in the USA. However, there are cases in Europe and around the world. The virus enters the body through the oral nasal route, and then the pigs will have profuse diarrhea as well as vomiting. And the virus infects the epithelium of the large intestines. This is different to TGE, where it's the small intestines. Older animals get stomach aches. And to diagnose the disease, we use PCR and ELISA. For prevention, we use an inactivated vaccine. An attenuated vaccine exists, however it is not used. Hemagglutinating encephalomyelitis only occurs in piglets with no maternal immunity. And because of this reason, even though the virus is widespread, clinical signs are rare, as most piglets get maternal immunity. In the clinical signs, we can see vomiting, constipation, as well as shaking, an arched back, and CNS signs such as convulsions, rolling the eye, and pharyngeal paralysis. Cyanosis can also occur in the legs. The clinical signs are seen in animals under 3 weeks old, and there's also non-purulent inflammation in the brain. To detect the virus, we can use PCR, ELISA, and viral neutralization. And differential diagnostic species can be Talfins and Ojeski's. Feline coronavirus A is a part of the alpha coronaviruses. There are 2 serotypes, feline enteric coronavirus, which makes around up 95% of cases, and feline infectious peritonitis, which makes up around 5% of cases. Feline infectious peritonitis is called FIP. So 95% of cats eliminate the virus, but 5% remain carriers, and then this virus mutates into FIP. The FIP mutation has 2 forms. There is the dry form, which is a type 4 hypersensitivity, and the wet form, which is a type 3 hypersensitivity. For the clinical signs, for the enteric form, the clinical signs only exist in young cats. They will get diarrhea, vomiting, sneezing, and nasal discharge. For the dry form of FIP, they get blood vessel damage, and this can cause CNS signs due to the vasculitis. And for the wet form of FIP, they get ascites as well as uveitis, as well as recurrent fever and decreased body weight in both cases. For the diagnosis, we can use PCR, ELISA, and the Revelta test. There is no treatment for the FIP form. And there is a vaccine for the dry form, however, vaccination is not recommended. Infectious bronchitis virus is found worldwide. It is a part of the gamma coronaviruses. The hosts are chickens and pheasants, and there is no germinative infection. And there is a horizontal spread in the feces and discharges. This virus can be summed up with 3 R's: respiratory, reproductive, and renal. The virus enters the body through the oral nasal route, and then the primary replication happens in the trachea, and then viremia occurs and it goes to all these parts. The clinical signs are mostly seen in chicks below 6 weeks old. They will get permanent oviduct damage, as well as respiratory signs. Growers get transient oviduct damage, and they can recover before the laying period, and adults have temporary oviduct damage. They will have decreased amount of eggs produced. So for the clinical signs, we will see sneezing, gasping, and nasal discharge, as well as conjunctivitis. And for reproduction, there'll be less eggs produced. And the nephropathic strains will cause uricosis to occur. The litter will become very wet and they'll become dehydrated. In the pathology, we can see a caseous plug in the trachea, and in the kidneys they become enlarged and pale. And the oviduct becomes degenerated. For the diagnosis, we can see dwarfism in embryated eggs, and we can also use PCR, immunofluorescence, and ELISA. And for prevention, we can give an in ovo vaccine in day-old chicks. The vaccine is inactivated. For turkey coronavirus enteritis, it is found worldwide. However, there's less and less incidences happening. It is a part of the gamma coronaviruses. There is a horizontal spread in the feces, and only turkeys are susceptible. The virus enters the body orally, and then there will be primary replication in the gut epithelium, as well as the cecum and the bursa fabrici. In the clinical signs, we will see foamy, watery diarrhea, as well as a blue comb and decreased egg production. In the pathology, we can see the bursa fabrici and the small intestines have inflammation and degeneration. Around 50% of young animals are killed, and only 5% of older animals are killed. For diagnosis, we can use PCR and ELISA, and there is no vaccination. For bovine coronavirus, it is found worldwide. It is part of the beta coronavirus genus. It has a hemagglutinating protein, which can be used in diagnostics. It is seasonal and is found in winter, and also occurs when calves don't get enough colostrum. These are the predisposing factors. And dogs can also be seropositive. The virus enters the body orally, and then the primary replication happens in the gut epithelium, as well as the lung epithelium. Then viremia can occur, and it can go to other organs. There are 3 clinical forms: the enteric form, the respiratory form, and winter dysentery. The enteric form happens in calves under 3 weeks old. They get yellowish, watery diarrhea. It often has co-infection with rotavirus, adenovirus, and E. coli. The respiratory form happens in calves aged 2 to 6 months old. It is a part of the bovine respiratory disease complex. It often has co-infection with parainfluenza 3, adenovirus, and mycoplasma, as well as environmental factors such as cold air and dust. In the clinical signs, we will see coughing, nasal discharge, and dyspnea. And for winter dysentery, it happens in adult dairy cows after they gave birth in winter. They will have decreased milk production, and this will cause economic loss. Their clinical signs are fever and diarrhea, and mild respiratory signs. In the pathology, we can see enteritis and villus atrophy, as well as interstitial pneumonia. And for the diagnosis, we can use HA for the hemagglutinating protein. And for prevention, there is an inactivated vaccine that is given to pregnant cows. For canine coronavirus, it is part of the alpha coronavirus genus. There are 2 genotypes, canine enteric coronavirus and canine pantropic coronavirus. For canine enteric coronavirus, there is a horizontal spread in the feces and has a high mortality. It affects young puppies. The virus enters the body orally, and then the primary replication happens in the gut epithelium. There is no viremia. They get yellowish, watery diarrhea, as well as vomiting sometimes as well. There is also a vaccination that is given at 6 weeks old. It's in combination with other vaccines. And for canine pantropic coronavirus, this is a hemorrhagic disease. The virus enters the body through the oral nasal route, and then the primary replication happens in the gut and lung epithelium, and then viremia occurs, and it damages blood vessels in the airways, as well as the lymphoid organs, which can lead to immunosuppression. The clinical signs are bloody diarrhea, and they can also get central nervous system signs,